couple of things to highlight. The first one is that we have continued to see our community transmission levels decrease. As you can see here, our case rate is dropped, continues to move down and into the low range. Additionally, our test positivity has been below 2% multiple days, and we've continued to make great progress in that area, indicative of the resilience of our residents, as well as the restrictions and policies that we've put into place throughout the pandemic, particularly in the setting of increasing our rates of vaccination for our residents. I would also like to say this too. So often we, at least in the public health side, we talk about things in the context of numbers. We've had to, because from a health perspective, we've been tasked with keeping cases down, keeping hospitalizations down, and keeping fatalities down. These are real issues in the terms of a pandemic. But we also recognize in making those decisions and determinations and putting forth that guidance, that those guidance and guidelines have had real repercussions on folks' livelihoods. As was discussed with tourism has been affected, restaurants have been affected, the daily routines of people's lives have been affected. And those of us in the health field are hopeful that, God forbid, we go through a pandemic again or a similar situation, is that we don't have to pit science and health versus economic realities for folks. And so I just want folks at home to understand that we are not insensitive to those issues. We're just continuing to put forth guidance to keep people safe and create an opportunity for economic development packages and policies and proposals to be put forward to address those other economic realities of the lived experience. So as we move forward, as you know, with the Board of Health resolution from several weeks ago, we included metrics related to the percentage of those vaccinated to reopening. And when we look at our data here, we're seeing a slower increase in the percentage of residents who received at least one dose, as that is now approximately 56%. And that is showing a slowdown of folks coming in to get the vaccine compared to where we were earlier on throughout vaccine distribution. At the same time, however, given that we saw such a high percentage of folks getting covered about a month ago and 6 weeks ago and 2 months ago, those folks are coming in now and getting their second doses. And so when we look at the number of those who have been fully vaccinated or have received both doses, that number by our Immunet standards are 43%. I believe the CDC graphic is a little bit closer to 47%, maybe 47.5% this morning. And again, we're defining fully vaccinated as individuals who receive both doses or the single Johnson & Johnson dose, and then being 2 weeks out from that. So just to give you a sense of where we stand in terms of those percentages, again, I am confident and hopeful. For example, now that the other big announcement that has come out overnight is that the FDA has given or provided approval for the Pfizer vaccine to be used for those who are 12 to 15. And the Commission for the Immunization Practices will meet on tomorrow to give the full final approval, and potentially the vaccine will be eligible to those folks in that age category as early as Thursday. I am confident and hopeful that with bringing in that increased eligibility, that will increase this percentage on the left, those getting at least one dose, fairly quickly within the short term to get us moving forward to that next level of reopening. And just to continue to move through here as we've looked through in previous presentations, and I'll talk a little bit more about the vaccine plan for young people at the conclusion of the slides, but this just again gives you some indication of the percentages of folks by age and race and ethnicity. And again, when we look at the weekly volume, we are seeing a drop in the number of folks who are coming in for that first dose, again, compared to where we were at earlier stages in vaccine distribution. Again, to underscore, the communications team is working to focus messaging on that 21 to 35-year-old group, and we are working with our colleagues both in the public school system as well as our non-public schools to do some focus messaging to parents and kids to ensure that, again, when that eligibility is officially increased, that they will come in and get the vaccine. This is just a cumulative total of where we stand in terms of the doses provided as well as administered. And again, showing the breakdown where our residents are getting their doses. Again, the county health apparatus appears to continue to provide the greatest percentage of those doses to our residents. Again, some geographic representation of our residents receiving at least one dose. Yet another graphic depicting that, and then here's our top tier priority zip codes based upon the impact of COVID so far that we've seen throughout the pandemic and vaccine distribution. Right. And so just a couple of notes beyond the slides and updates. So as I mentioned, the FDA did give approval for the Pfizer vaccine to be used for 12 to 15-year-olds, and the ACIP Commission will be meeting on tomorrow to give the final go-ahead. And we are planning for that eligibility to be increased and go into effect on, Thursday. Now, a couple of steps that have been put into place already to help prepare for that. As we talked about last week, we have been working and preparing for this, knowing that it was going to happen. Is that if you are in that age group, you can pre-register on the county website. There are provisions in place for you to register your child for that. Secondly, there has been a lot of discussion related to the issue of consent and how that can be provided. The guidance that we've received so far is that parents will need to be present with their child when getting the vaccine to do an age attestment for the child, as well as to sign the consent on site for them. And we are, by increasing eligibility on, let's say, for example, does go in, if everything goes smoothly as anticipated with the hearing tomorrow and Thursday morning, when folks wake up, 12 to 15-year-olds are eligible for the Pfizer vaccine, they will be able to utilize any of the county sites where we do have vaccination in place, where Pfizer is being distributed, as well as any of the other venues throughout the state where Pfizer is distributed. I want folks to understand that so they can register, or now we have moved to a walk-up system. They would be able to walk up to any of those sites and get a vaccine just as any other resident in the county. Again, it's specific to Pfizer. And based upon our allocations from the state over the last 6 weeks, we have been receiving almost exclusively Pfizer doses. So young people in that age group, parents, you could bring them to any of those sites. Now, we are working to recognizing that with parents having to come with their kids, at least in the short term, is that there may be some challenges for folks having to take off during the middle of the day or needing to have after hours or weekend hours. And we are working to set up some youth-specific clinics that are in the evenings as well as the weekend. So we don't have those finalized just yet, but please stay tuned. We're aiming to stand up a couple of those later this week and over the weekend. And again, just to remind folks is that when eligibility is officially confirmed, any of those young people are able to utilize any of the pre-existing sites that are offering Pfizer throughout the county. One other update, a couple of other updates to include. As you know, we have been working with FEMA to do strike teams to provide additional support. They reached out to us to provide 2 fixed sites for approximately 7 to 10 days during early June. To provide 200 doses a day. We have been working with them to finalize those 2 locations. One will be in Up County and one will be in Down County, most likely in the East County area. We're finalizing the MOUs for that, but we do have a couple of sites selected, and once they are official, we will make that announcement and pronouncement to the community. We continue to work through our list of folks on our homebound list. Over the weekend, the team was able to vaccinate approximately 25 individuals. We still have approximately 185 names on our list. I do know we did receive at least one message this morning from a member asking about a family member who had, not their family member, but someone, a resident in the community, who had asked about their family member getting vaccinated. We're continuing to move through the queue, so please stay tuned and continue to make sure you follow those guidelines to minimize any risk of exposure to your family member who is homebound. Those are the global updates that we have from the public health side. I will stop there and turn the floor over to Dr. Stoddard, but happy to answer any questions that you all may have. And I think I covered everything. I don't know if Dr. Bridges is on, if there's any additional items to include, but certainly we're happy to answer any questions that you all may have. Thank you.
Good morning, everyone. I don't have any additional updates. Just want to offer my congratulatory remarks to all of the individuals who participated in the junior board members. Allison, great public health message. Look forward to you participating in either the council sitting as a board of health or any HHS related committee sub-meeting. So thank you all.
Thank you. Dr. Stoddard.
Good morning, and I'll echo all the comments. Allison, great work. Very much appreciate all of our young people participating and getting involved. A few things I want to add. So I think it came across in Dr. Gale's comments, but I want to make sure this is a real strong point. We have gotten through our entire pre-registration list. The only names remaining in our pre-registration list are names for which they provided a zip code outside of Montgomery County and actually outside the state of Maryland. So that's progress. A few things. So we did a text messaging campaign last week. I think it took place largely on May 5th, but in the couple days after that as well, where we targeted areas where we thought we had disproportionately low vaccination rates, particularly in Black and brown communities. We sent out 147,000 text messages to individuals trying to encourage them to come in and get vaccinated as an additional outreach method in addition to the work that we've been doing with our census count teams, our CCC teams, in getting out and getting people scheduled for appointments, direct outreach for those. Dr. Gale has already touched on the MVU, the mobile vaccination unit from the state. We have our mobile teams that are already here supporting efforts, including expansion of the hours at the Silver Spring Clinic, but they'll have the actual large van here next week on the 18th through the 23rd, and then again on June 4th through the 13th. I believe we are targeting the Lake Forest Mall for next week, and then we have additional. We have not finalized the plans for the following week, looking at several sites, trying to get more community-based sites. So more to come on that. I did want to note one thing that we did hear from the state this morning, and that is that some people were already attempting to make and may have successfully made appointments at some of the state sites for individuals 12 to 15. Just realize that absent that CDC and ACIP approval, they will not be able to honor appointments today and tomorrow until the ACIP meets. So if you were able to, through the state system, to make an appointment at a state site for a 12 to 15-year-old, just realize that they will not provide you that vaccine until the CDC approves and MDH gives the all clear for those appointments. And as Dr. Gale said, that will likely come on Thursday or soon thereafter. You will have seen our announcement yesterday that there will be 6 libraries opening at the end of, I think June 1st, and then 2 senior centers that are being opened in the press release. At the county executive's direction, they're already proceeding with additional work to prepare additional libraries and recreation facilities to open soon thereafter. As was noted in the press release, there are still two senior centers being used as vaccination sites. That's Wheaton and Wagoke. One's being used as a shelter, which is Long Branch, and 2 the Margaret Schweinhut and the North Potomac are being used for youth activities, and those will not open until August of this year, given that they're being used for youth summer camps and allowing for the expansion of those efforts. And then finally, we did receive yesterday, finally, after much waiting, the Treasury guidance for the Arpa funds that came in at like 1 o'clock yesterday afternoon. The county attorney and the Office of Management and Budget are reviewing those right now to give us some direction on how those funds may be utilized, particularly as it relates to the spending. As some may realize, but probably not all, those funds are going to come in 2 tranches, one this May, one next May. And there's a lot of questions about how the May of next year funding and when May of next year funding can be utilized. Can we utilize it now and then sort of through the bookkeeping process, book those costs to those dollars that will be arrive next May? That's what we're reviewing the documentation for today, and I don't have an answer for that yet. But I did want to share that we did receive the Treasury guidance for those funds and are actively reviewing them to answer those questions. That's all I have for this morning. Happy to take any questions.
Thank you so much to all of you. Councilmember Reamer.
Thank you. Appreciate the briefing this morning. And again, it's so nice to be able to see progress. I think we're probably all alarmed by the slowdown of appointments, but we also know that we knew that was going to happen. I think it's sort of amazing how far we've gotten through. I have a couple of quick questions. Generally, I wanted to just clarify again. So, Dr. Gales, I think you said that pre-registration with the county is now open for 12 to 15, and you can now register with the state for 12 to 15. You may or may not be able to get an appointment at a pharmacy or a hospital yet, but in any case, likely tomorrow after ACIP has issued, that is the first opportunity for any administration of doses. Probably Thursday, I think actually Dr. started it. Likely Thursday, that would be the first opportunity for actually any 12 to 15-year-old to get vaccinated. So those who want to be, early in line, those are your channels. All right, great. Just wanted to make sure I had that right. Thank you. I'm glad to hear about the student outreach campaign. Thank you for working on that. I would love to see us adding more resources to the Homebound operation. I don't know if our clinics, if we have teams that just aren't yet being fully utilized, or they aren't being fully utilized just because of the fewer appointment, and we could beef that up. But I imagine that there are a lot of families that are getting very anxious about whether they will be reached, and they're unclear, why it may not have happened yet. Okay, the general question I have is about our reopening framework, and I know this goes as much to my colleagues on the council as anyone, but it seems like we are converging with stage 2 and stage 3 in the potential timing. That, given we have a 95% roughly success rate with second doses, it could be that we'll hit our threshold for county residents who've had both doses, by the end of the month. I will say, when we first adopted the framework, I thought we were adopting a framework that said once they have been administered their second dose, as opposed to the additional time that it takes to get to full immunity, which is the text of the language. But first question I have is, if we hit stage 3 sooner than stage 2, is our health team comfortable with just proceeding based on stage 3? And then, so that's my first question. If I could just ask Dr. Gales and Dr. Stoddard and team about that.
Sure. Well, thank you, Councilmember Raver, for your question. You do bring up a good point based on the way the numbers are going. However, I would say that we are still more likely to hit phase 2 before phase 3, given that the phase 3 definition is based upon the 2 weeks after we hit that number. So in looking at the numbers, I would still speculate that even if we were to hit 50%, we'd still have that 2-week window. And I do think that there is, within that time period, maybe even about the same time, again, given that we've got more young people being eligible for the vaccine, and I do anticipate that there will be an influx of parents bringing their kids in for that protection, there would still be a phase 2 and then a phase 3. But again, I think if we were to hit the 50% protection level, if we put forward the guidance there, I think we would be at a place where we would be able to move forward with that guidance.
Thank you. As I was talking, as I was saying the words, it became clear to me that, as you explained, thank you. Okay, well, generally, I just want to say, in the beginning of the pandemic, I think it was so important for us to be ahead of the curve on shutting down and enacting strong protections. I think we've reached the point now where we need to start thinking about being ahead of the curve on reopening. Our cases are fortunately down at the lowest level they've been throughout the pandemic. And, just thanks to the nature of that, because of both the combination of the vaccination campaign and the fact that people can now do more outdoor socializing. It just doesn't seem like there's a theory that would lead to a resurgence of the virus. And so, I think it's urgent. They have other urgent public health issues that are affected by our shutdown. The social isolation, the lack of gathering, I think is its own problem. As we all know, we are grappling with those problems all along. And I think we've kind of hit that inflection point where we've got to get, I was, speaking with a friend the other day who was so worried about her mom because being isolated causes decline for people who are, older, like very much older. And she's worried that her mom's decline and may be irreparable because of this past year. Those are very real consequences as well. And I think we've just got to ensure that we are leaning into reopening now and, moving as fast as possible. So certainly that applies to public facilities, but, it applies to private as well. I do wanted to ask, there's been a little confusion. I think we're all I know that full immunity is like full immunity. Like you're 96% unlikely to catch the virus, or, it's 96% protection depending on your vaccination. And then it's 100% protection from serious illness. I don't know if there's ever been a case of serious illness documented with someone who has reached full immunity. What is your general guidance for people who have reached full immunity now? There are a lot of people in the community who I think are, glad to have full immunity, but still we're all so traumatized by this experience that many people don't know what is safe and what to do. So can you just talk a little bit about what you would suggest for people who have reached full immunity, even if they're a bit older, or maybe, there's a lot of folks in that category. They were the first to get vaccinated, So what should we all be comfortable seeing around us, and what should we be comfortable doing as people? Thank you.
Well, I think there'll be multiple answers on this one, so I'll try to keep my piece succinct on this. To give you an example, you're right. So we have been asked to do a lot of things over the last year, and there is going to be this ongoing. I've seen a lot of articles pop up from one side or the other talking about, how far is too far, and, how do we mix that in? What I can give you as an example of this weekend, I visited my parents for Mother's Day, and my parents were fully vaccinated. My family members who were included in that fully vaccinated, aunts and uncles fully vaccinated, because they fit that older group that you mentioned. I don't know how comfortable they'd like me saying that, but they do fit that older group.
I had the same hesitancy in saying those words.
In that older group. But we were able to get together as a family. We had a barbecue. No one wore masks because everyone was vaccinated, and we were able to hug each other and enjoy each other's company and feel comfortable, as you pointed out, having reached that fully vaccinated status, being able to have those types of interactions. And it also gets to your earlier question in terms of isolation. So as things stand, people can get up and they can go and they can have gatherings and they can go out in public. I think there is still some residual as things kind of get worked out and the language from CDC and the states become a little bit more clear, because there seems to be a little bit of fogginess there in terms of interacting in public spaces. And so, as another example, I'm fully vaccinated when I'm walking out in public. So technically, I probably could walk around without a face covering on, but I still do carry that practice to model, that type of behavior for those who are unvaccinated. So what I would say this is yes, you can get together with folks, particularly those who are fully vaccinated. And even when you are in a small gathering, again, that's limited in the sense of how many networks or other households are involved, is there are opportunities to get together with folks, to socialize, to connect, plus minus with your face covering on. The consensus seems to be we're still recommending folks, particularly in larger gatherings or crowded spaces, particularly as capacity increases, that it's just good practice to still wear your face covering. But that's a long-winded answer to say that there are options for people to connect, to break through those concerns about isolation, because yes, those are real. And there are real opportunities to engage in meaningful ways, not just physically distancing ways, but actual, physically touching people and having fellowship in those types of environments.
And have there been any cases of individuals who have been fully vaccinated and then became seriously ill from COVID?
I'd have to take a closer look. I do know that there have been some breakthrough cases. I would have to go back to get the exact number, in terms of what that translates into hospitalizations or severe cases.
I mean, we know that there is rare breakthrough transmission, but I understand that even if you have breakthrough transmission, you don't get seriously ill. So it's essentially 100% protection. That's my understanding, but I would appreciate, if we'll have that conversation again.
Yeah, if I may add, council member, if you've been vaccinated and you're not around, for example, like I still have young children, and they can't be vaccinated yet, so I have to operate a little bit differently. But for the most part, I feel entirely comfortable going out into the public space, indoors or outdoors. I'll still wear a face covering inside because that's still a CDC recommendation. But generally speaking, I went to the Rio in Gaithersburg this past weekend. Was outdoors. We did the carousel. We did the walked along. We did indoor. We did, I guess, outdoor dining was on a patio, but still counts as outdoor. But I think the vaccines are quite effective, and I think over the weekend we saw a couple of on the weekly news stations, some of the experts that we look to saying essentially, once you've been vaccinated, the risk from COVID-19 is lower than the flu. Right. And so these vaccines are actually more effective than the flu vaccines, particularly the Johnson & Johnson and both the mRNA vaccines, Pfizer and Moderna, are more effective than our annual flu vaccines are. And so people should feel pretty good. Now, obviously, we still can't vaccinate our young people all the way yet. And so, if you have young children, you probably take some additional precautions that you would others. But if you're a senior and you live with your spouse or aren't exposed to children with regularity, you should feel pretty comfortable living your life and getting back to some of the things that you were doing. I do think as it relates to, I think your point about the isolation is absolutely correct. I think some of that is as you noted, sort of self-imposed by being sort of conditioned for a year to feel hyper cautious, and people should start to feel like with vaccines on board that you can do more things. That there would be no reason to be vaccinated if we couldn't do more things as a result of it. And I think that's sort of the point I would get to. So people should feel more comfortable coming out and doing things with their families, with others, just with themselves in the public space now that they've been vaccinated.
Thank you for saying that. I do think we need to encourage that. I just think that it's hard to absorb this now. It's a big change. Thank you.
And Councilmember Reamer, I'd just like to briefly speak on your question around our homebound vaccination program. We started with about 1,300 pre-registrants for our Homebound vaccination program. I reached out to our community partners who supported a pilot just for those individuals who were homebound. We had the pause with the J&J vaccine, and then we resumed. As I've updated the board, the council sitting as a board of health, we implemented a survey. We reached out, we called folks, we expanded that to not only vaccinate those homebound individuals, but their caregivers and families as well. Unfortunately, some of those individuals, when we called back, were hesitant to receive a vaccine, and we encourage all, if you receive a call from the Department of Health regarding a vaccine, please answer the call and receive your vaccination. Some folks have asked for the Moderna or the Pfizer vaccination or the vaccine, and we have been accommodating folks, but we still have the Johnson & Johnson doses available. In addition to the homebound vaccine program, we continue to vaccinate those individuals who are not homebound, but who may be homeless and transient in our services to end and prevent homelessness. And lastly, we continue to support the corrections department with vaccinating those individuals who unfortunately are go through their system. And so all of those programs and activities are still in place. So it's the homebound vaccination program. And again, the most important part of that is that we encourage folks to get vaccinated with the vaccines that we have available. And if we call, please answer the call.
Thank you. Just encourage you to beef that up. Glad you're doing it. Anything we can do to get through that final list here as quickly as possible, I know people will be immensely appreciative. Thank you so much. Appreciate that.
Thank you. Councilmember Rice.
Well, thank you very much. And thank you, Dr. Bridgers, Dr. Gales, Dr. Stoddard, for your tremendous work. We couldn't have gotten to the place that we are right now if it weren't for the great work of you and all of the staff within HHS. So just thank you. Just very quickly, Dr. Gales, because I didn't get a chance to look at the number, how many people, right, not percentage, but how many number of people are still unvaccinated among those eligible? What's that number? Does anybody have that?
I could do a quick. So I think it's about, we have about 70% of eligible residents who have received a first dose. And I think that was 850,000 people. So if I pull out the calculator real quick, I can give you a rough number of people that leaves. That leaves roughly 250,000-ish people who have not, among the eligible, who have not chosen to come forward and get vaccinated.
So 250,000 people, right? That's still a lot of folks. And so I would just ask those who continue to reach out to us and insist that we lift mask mandates and that we're continuing to open stuff, to make sure you're reaching out to your neighbors, to your family, your friends, those that you know, and you're encouraging them to get vaccinated. That is how we lift all of these things, because that's a significant number of people who still are at risk, right? While the majority of us are vaccinated and are able to do the things like Dr. Gales talked about, like Councilmember Reamer talked about, getting out, getting that socialization that is incredibly important. You know, those are the things that we're all working towards getting to, but those folks are standing in the way. And so we have to make sure that all of us are doing our part. It's not just the county council, but it's all of us as individual residents and friends and family, loved ones. Just encourage folks to continue to get vaccinated, because that's going to allow for us to achieve what Councilmember Reamer was talking about, which I agree with, which is that we all want to get back to that sense of normalcy, to be able to hug your family and be able to hang out with them again. We got the summer upon us, to be able to take a jog and not have to worry about anything. Well, the great way to do that is to become vaccinated. And Councilmember Reamer, to answer your question, because I had talked about this a couple weeks ago, breakthrough cases are incredibly rare. I think it's one in which somebody equated it to winning the lottery and getting struck by lightning in the same day. I don't know many people who that's happened to, and so it's very rare to have that and then have like a serious health complication, including death. It's incredibly rare. And so from that perspective, yes, the vaccination is your key to your sense of normalcy, but it's not only the key to your sense of normalcy, but it's the key to all of our senses of normalcy. So let's not hold everyone back. Let's make sure that we continue to get vaccinated. And just another point, I already just in this, Dr. Gales, you had mentioned about being able to pre-register. While you said that, I pre-registered my daughter. So she's now pre-registered. So it does work. And just for the state site, Councilmember Reamer, just to let you know, I actually went on PrepMod to see if you could actually do it. And I think it was Dr. Stoddard who had mentioned this as well about people who got appointments. I'm not sure how they could, because when I put in the date of birth, it said that she's not eligible. So unless they somehow manipulated the date, it's not allowing you to make an appointment for any of our mass vac sites. So I tried both just to see what would happen. And so just want to give that feedback. So for folks, make sure you pre-register for your young folks that are age 12 to 15. Pre-register, it works. It took me literally 2.5 minutes to type it all in. And if you need assistance, we have programs that will allow you to do that, both with technology, or you can call. Let's make sure that we get our young people vaccinated as well, so that we can get even more of our kids safely back into school in the fall. Thank you.
Thank you. Council Vice President Albornoz.
Thank you. Good comments and questions, and another positive report. We continue to make just tremendous progress in so many areas. Just 2 questions today. The first is Mayor Bowser announced yesterday that the District of Columbia is shifting some of the timeline that they had anticipated for some of their reopening. I was looking at their reopening plan, and correct me if I'm wrong, Dr. Stoddard or Dr. Gales, their reopening plan seems very consistent with our phase 3 reopening. The only difference being on some level, with some adjustments, that they're setting a specific date as opposed to our benchmark, which is based on the percentage of people vaccinated. But as you look at line item by line item, their phase 3, our phase 3 versus what they announced yesterday are pretty consistent. Is that accurate?
Yes, our phase 3 would largely be their second phase, which would be June 11th, because they still have 50% for, I believe, bars and other venues as part of their first phase, which I believe is May 21st. So once they get to their final phase, they look pretty much exactly like the phase 3 that we have as well.
Terrific. And obviously, as we've all noted, the regional approach to addressing these issues continues to be critically important. So we received some questions about that on our media call on Monday. And so I think it may be helpful for us in some form or fashion to just clarify or let the public know that we're more aligned than it may seem, as just folks that are just reading newspaper articles and not entirely focusing on this. Because I think that's important. And then just the second question is, I mentioned this last week as well, but now that the imminent approval of the vaccine for 12, 15-year-old, and now just a question of when, but not if. But there was a report, again, the Today Show talked about it again this morning, that on a national survey, about 30% of parents indicated that they would sign their children up as soon as possible to receive the vaccination. But an alarmingly large percentage, almost also 30%, said they were going to wait and see, which you can understand to a certain degree. But Dr. Gales, if you could just, both as a pediatrician but also as our public health officer, you're uniquely positioned here. Just any guidance that you may want to provide parents, just any concerns that parents may have in their child securing the vaccination. And obviously we want to encourage them to speak to their pediatrician, but if you could just make a couple points on that, I'd appreciate it.
Sure. Thank you, Councilmember Albornoz. Before doing that, I would like to just add to your first point that you made, so that folks at home, again, are aware that we do talk with our colleagues across the region and across the state. And when we were having our discussion about reopening, including vaccine metrics. I did have some conversations with, Dr. Nesbitt, who's DC's Department of Health director, to share with him what we were doing and to get some feedback. So we continue to work together as a region to make sure that we're all on, or as close as possible to being on the same page. Now, to pivot to your second point related to potential vaccine hesitancy in children for parents, the information that has been shown so far has been overwhelmingly positive in terms of minimal side effects with children and no reported significant illnesses or symptoms experienced by any of the children who were a part of the clinical trials for the vaccine. It's important to note that back in December, it seems like so long ago, well, back in December, when the EUA was granted for adults to get the vaccine, the companies, Pfizer included, began clinical trials enrolling younger people in the age groups to be able to test out the safety of using the vaccine in those groups. And the data that they have received from those studies, again, have been overwhelmingly positive, have been consistent with the safety parameters that were found with the adult and the older populations that were approved and have been used in millions of vaccines distributed across the country and across the world with minimal negative events and minimal side effects. So we encourage you to, certainly, again, have conversations with your healthcare provider to discuss your specific concerns. But the information that we have available is overwhelmingly positive. It's overwhelmingly safe. And to Dr. Stoddard's point earlier, the numbers in terms of safety and prevention of illness outpace some of the routine pediatric vaccines that we already administer to children on a routine basis that have historically been extremely safe and extremely effective.
Super helpful, very important. That's it for now. I yield back to you. Thank you.
Thank you, Councilmember Friedson.
Thank you. Echoing all the comments about the progress that we're making and appreciation for all of the hard work of the public health team, Dr. Gales, Dr. Stoddard, Dr. Bridgers, everybody else in the health department. A few questions, just building off some of the comments and questions that have been made up to this point. The 47.5%, which is the full dose schedule, not necessarily fully vaccinated, but full dose schedule from the CDC. Do we have a timeline of when that's going to be shared publicly as part of the dashboard so that residents can see it in real time?
Yeah, they've been looking at the data set for the available data from CDC. I'm hoping that it's done and up this week, but candidly, I'm now wondering whether we're gonna get to 50% before it gets posted, just because the data is just in a vastly different format than we have it, and they're trying to reconcile the two numbers, the two data sets. So no update on when it's going to happen. But they're actively looking at it now. It's just the CDC data is a very different format than the Immunet data, and so it's hard to, get exact numbers. I mean, we're going to use the 47.5% just so we're clear, but I think that displaying on our dashboard is becoming a challenge just because of the format the data is in.
Maybe I don't quite understand the back end challenges of posting on the website, but why couldn't we just post three separate numbers? The two numbers that we currently have there, which are based on those who've been vaccinated in Maryland, and then the CDC number, and note that the first number, which is the first dose number, which is the only number that we have, and then the CDC number, which is the full dose schedule number, are the numbers that pertain to that order, and then explain what that means in terms of.
It's just explaining all that on one dashboard is hard. So that's a fairly easy thing for us to do. It's just to post the third number. I just would expect that would be viewed as extremely confusing for many of our residents, given that we can't have there isn't a ton of space on the dashboard to have a lot of explainer for why data is different, and that's why it's easy to tell a long story, but it's much harder to tell a short story. And I think that's the tricky thing that we face. So I mean, we could absolutely just post the CDC data and say the 47.5% number and update it, on a daily basis. But obviously, we would get tons of questions about. we would just get a lot of questions about it. We get a lot of questions about the data as is. And so I think it would be very difficult to explain to people the nuances of the two separate numbers and why the third number, which is the first dose number, isn't also that we don't have a CDC equivalent for that. We were trying to find one, but we don't have one.
One of my favorite lines is, I apologize for the length. This, I didn't have time to write something shorter.
Yeah.
I totally appreciate that and understand that and take to heart my own, hits close to home sometimes in terms of brevity. But I do think the numbers that people care about are the numbers that pertain to our orders, because those are the numbers that are restricting their lives. And so I do think that we have, to a certain extent, all of us who have been so immersed in these issues, and you probably chief among them with Dr. Gales, Dr. Bridgers, we're kind of missing the punchline here. And the punchline is, what does this mean for what the Board of Health has done, and how does it impact my life? And so I think we should start there and then back into what is the best way to display the information that people are looking for and that they need. And I think right now we aren't displaying the information that they need. So I'd be happy to chat with you offline. I know that you're working hard on this, but I do think that the only data that matters to be posted in a clear way on the dashboard is the data that residents need to see in terms of how it impacts their life vis-a-vis the Board of Health regulation. So I would just make a strong push for that to be the chief goal, and that we not let the perfect be the enemy of the information that people desperately need to see. Okay, so related to that, the community partners, I visited a few of them. Many of them are doing all of the information by paper, and then presumably after the fact, somebody is going in and entering that data into Immunet or some other place. It's not quite as automated as the health department and some of the other, maybe even the pharmacy clinics. Do we have an understanding of what the delay is from when shots actually go into arms, first shots actually go into arms, to the point at which it shows up in the data that we're seeing in Immunet and you're seeing in Immunet, and that is being posted on the website?
So thank you, Councilmember Friesen, for your question. We're required to enter that data within 24 hours, whether it's electronically or paper format, and that's the same requirement we have. As you may recall from previous conversations, we did have some issues with some of our community providers weeks ago. We worked with them to clarify and correct that. And so, in fact, the majority of our providers are actually entering that in directly. And if they are using paper, it's still within a 24-hour period, with rare exception. So that information gets input fairly quickly, from when an individual received their shot into, how it's referenced in the computer system.
Okay, so with rare exception, we really couldn't be more than 48 hours behind, because it takes 24 hours to enter and then 24 hours to capture the update on, publicly at noon every day, or the time at which, it gets done. So it's 48 hours or less. That's very helpful. I think a lot of people have asked that, so I think that helps to clarify that. I appreciate that. Excuse me. The issue of the website and pre-registration, I just wanted to note that separately from the dashboard issue. I just think there's an opportunity now to take a look at that. It's not clear. The top part says that you can make an appointment now. The bottom part says you must be pre-registered in order to make an appointment. Now that there is a pre-registration, at least for a few days, for 12 to 15, I hope that we can get that updated today, and make very clear that if you're 16 and older, you can book your appointment immediately. If you're 12 to 15, pre-register. We expect, here's what we expect in terms of timing, in terms of youth clinics. We expect parents to have to be with their minor child in order to do it, et cetera. I think that would be really helpful. And I think all of us need to work really hard to get that information out as quickly as possible. Obviously, a lot of people are going to be wondering, they saw the approval yesterday, or the pre-approval, but it's not the full approval. And so we all just need to work hard together. Your information here, I think, is a really good start. And I think we need to, amplify that and provide you with that microphone. But if you could take a look at the appointment page and the pre-registration page and just work on clarifying that with the team. I think that would be much appreciated. It also says that you can't share your appointment links, that your appointment link is just for you. I think we changed that, and now we want people to share their appointment links because we don't have the same issues that we had before. And so there's just a lot of, it could use a scrub in terms of what the current information is as I reviewed it yesterday.
And if I may, council member, because you brought something to top of mind as well. We have been receiving both at the county health department level, but also at the mass vaccination site level, Pfizer and Moderna doses to an extent. So people will need to pay attention once the clinics are scheduled and when they go to make their own appointment as to which vaccine is available at a particular clinic. We don't have both vaccines at a single clinic typically, because that's where mistakes happen. And so if you see a Moderna clinic, then obviously that's going to be for an older age category of people. And so they need to, if you see a clinic and it's scheduled, we've actually tried to front load Moderna this week so that we could have Pfizer doses at the end of the week available for, presuming the 12 to 15 will be expanded. But that doesn't mean we'll have expended all of our Moderna doses. And I'm quite confident we'll be having Moderna doses at one or two clinics a week. And so people need to realize that because we don't have exclusively Pfizer, you'll have to pay attention to what the particular clinic is that you're signing up for once you can make your own appointment, particularly for that 12 really to 16, because Moderna, you can't do a 16-year-old either.
Appreciate that. Okay, quick additional question. The 12 to 15, do we have an understanding of how many people in that category? I know there's approximately 850,000 that are currently eligible. Do we have an understanding of how many people we're going to be adding when the 12 to 15 officially become eligible in a couple days?
Yeah, our best estimate's approximately 3 to 4% of the population, which would translate to 30 to 40, maybe 45,000 people. 35 to 40, I'd say 35 to 40,000 people is probably our best estimate of what that population looks like, based on the census data.
So that brings the number up to like 880 to 890,000.
Yeah, I think it's actually about 871 right now that are eligible. I think if you did, I think it's 83% of the population. We have 1.05 million people. It's about 870. So if you add, we're about 900,000 people that'll be eligible after the CDC acts.
Okay, great. All right. Appreciate what Councilmember Albornoz, Council Vice President Albornoz mentioned about the DC numbers. I think it'd be helpful for us to think through, based on the current timeline of where that puts Montgomery County vis-a-vis DC. I think it's much more similar than it may have seemed at first blush. I think it's easier for people to comprehend a very specific date. And so, I think there's a little bit of misunderstanding there, but I do think in reality, they're pretty similar. Would you agree with that? Just to reiterate what, not just that our phase 3 and their second phase are quite similar, but that the timeline, May 21st, and then later on in June, that we would be around that point, most likely.
Yes, I would agree.
Okay.
I think we'll be at our second phase before they get to their next phase, which is May 21st. I think we'll be there before May 21st. And I think we'll be at our third phase before the June 11th timeframe. We're at 47.5%, as you noted on the CDC dashboard. We've been going up about 0.6% per day. So I would guess by early next week, we've reached our CDC threshold, which would start that 2-week clock. And so right by the end of June is what I'm, maybe the first week of, end of May. Let me clarify. I think right by the end of May, we'll be there, or the first week of June for that last phase.
Great.
And I just would like to add this. So this is just a continued note for folks at home. This is dependent upon folks coming in and getting vaccinated. So we need you to come in and get vaccinated. So when we're talking about, I would say, I know we've had some disagreements about numbers throughout the pandemic, but here's a clear one. Our reopening metrics are tied to the percentage of folks vaccinated. You control your destiny on that one. So please, if you haven't been vaccinated, get vaccinated. If you have family members or people in your network, get vaccinated. Yes, the ultimate reason to get vaccinated is to protect yourself and protect your health. But as been laid out by you, Councilmember Friedson, and your colleagues, this is the key to us being able to move forward safely and ensure that we don't have to take steps back.
Well, there is absolutely no disagreement anywhere here or in county leadership on that. We've had small disagreements on small issues, but there's universal agreement on that. So thank you for reiterating that. Last question, I promise. Outdoor transmission. There is a ton of confusion with the CDC and with lots of conflicting information on how prevalent outdoor transmission is, whether under 10% or under 1%. You know, under 1% is under 10% technically, but it's quite different. Could you just explain to us what you're operating under based on the guidance that you're providing us and the guidance you're providing to the county executive, the school system, and others based on what our operating assumption is of how prevalent outdoor transmission is with COVID-19?
Well, I think the most important thing is whether 10% or 1%, I can't speak for CDC and the specific doctrines that they looked at, but we do know that when you are in, whether you're in outdoor or indoor places, when you're in close contact with other individuals within that a short amount of space, that yes, you can transmit from person to person, and unvaccinated people in particular. So again, I think the most productive conversation around this is looking at the types of activities that are involved. If I'm standing on one side of a football field and you're standing on another one, yeah, it's extreme. We're not going to transmit from person to person. But if we are within, several feet of each other, not covered, not wearing any mask, we're not within each other's households and networks of traditional networks, the risk of spreading through outdoor transmission is significantly higher. So I think it depends on the type of interaction and depends on the type of spacing and those kinds of things, which would influence the risk of transmission from person to person. Now, certainly the risk in an outdoor setting is smaller than if you're in an indoor setting where ventilation is different and you're in an enclosed environment. But I think that is, unfortunately, the wording that CDC used has created confusion within that. But I think the most beneficial conversation around is the type of activity and the type of interaction that people have that influence the risk of transmission more so than just throwing out a general number.
I would completely agree. I think Dr. Gales has answered this phenomenally. I think it's not an outdoor versus indoor. I think the one thing we have to realize is we've largely either discouraged people or in some cases prevented people from having large outdoor gatherings where they're in close concert. And so therefore outdoor transmission, if you look at the whole history of the pandemic, has been very rare because we've limited those opportunities, as Dr. Gales has said, where the transmission is likely to occur outdoors, which is in close proximity, large gatherings outdoors. Because we haven't had many of those, outdoor transmission is likely very rare. But if you allow more of those outdoor gatherings with people in close contact, you may see that you're seeing more transmission in those circumstances with unvaccinated people. But I think we all agree that it is orders of magnitude safer to do things outside than it is to do them inside. And so I think, generally speaking, people should do outdoor activities and feel good about them, about doing them. If there are large gatherings, we would still encourage face coverings to be worn in those circumstances. I don't think face coverings are this huge burden that we should be able to do these events and do them safely. If you have smaller events, as Dr. Gales alluded to with his family, you don't need to wear the face coverings in those smaller events, particularly when everyone's been vaccinated. If you're unvaccinated, you probably should still be wearing the face covering. But again, he just encourages you to come and get vaccinated, and then you can, we'll have more people with which to do all kinds of activities without masks and other things. So, yeah, I think in summary, outdoor much safer. Outdoor close contact with other people is probably still something you should, be wearing a face covering for, particularly if you're unvaccinated.
Thank you, Mr. President.
Thank you. Councilmember Joando.
Thank you. Good morning. And as always, thanks for all the work that you all are doing and great updates. I just wanted to touch on the progress and any updates and conversations that you've had with MCPS regarding as we move into obviously next year. We've gotten through the various stages of opening. Is there any discussion around the guidance for distancing and those kind of how we might be able to get more kids in the building? Obviously, the conversation we've been having about vaccinations is critically important. We need to get as many young people vaccinated as soon as possible as they're allowed here, hopefully starting this week. But could you just give an update? I think that's a question we all receive at various points in time from many residents, and just kind of where those conversations are and what the latest is there.
Thank you, Councilmember Jawando. You are right. We get a lot of those similar questions returning to that. What I can say is, so as far as I know, there have not been any updated guidelines from what the CDC has put forward and the state has put forward approximately a month ago related to those distancing guidelines, 6 feet in universal places and 3 feet confined to the instructional classroom setting. Now, that said, I do know that MSDE and MDH are working on, new guidance as the percentage of residents covered by the vaccine increase. And certainly as young people do get those opportunities, and there will be an increase in the percentage of those folks who are covered and protected within that. And there have been initial conversations, including the health officers, for feedback to talk about what this school will look like in the fall. I think all of us are working under the assumption and working with the plan and motivation to be able to get all of our kids back into school safely at regular capacity. And so I do anticipate over the course of the next month or so that there will be further studying of those best practices that have been put into place over the last 6 months to minimize transmission. There will be a better understanding and hopefully a higher percentage of folks covered by the vaccine, again, including the young people. And then I think during the same time period, I think there will be further conversation and guidance from the federal level as well as the state in terms of how those distancing parameters may be relaxed or changed or altered. But in consensus, I think that all of our collective energy and efforts are to be able to get kids fully back in the classroom in the fall, pending obviously no further changes or, what's the best word to put it? No things to deter us from the continued. Yeah, no setback. There we go. No setbacks. That's what I was looking for. No setbacks within that. But that is, I think, the collective effort and energy and desire to get everybody back in.
Well, I appreciate that. I think that's an important statement. Again, we talked earlier in this process about kind of putting the light at the end of the tunnel. I think, that was one of the clearest statements I've heard, that is the intention in the fall, that all students return to school. And we're heading in that direction, and conversations are happening at the federal, state, and local level to update guidance and to continue the vaccination process, right, where we are to make that happen. And again, to your point, we have some control over this, right? The more people get vaccinated, the better all of this becomes for everybody. But, having just entered, as many of my colleagues, having kids in the school system, just entering the last quarter of the year, people are trying to figure out what are they going to do for summer. We had a robust discussion here at the Education, Culture, and Fed Committee and the whole council really about what are the summer supports that are going to be in place. And I think knowing that we can get, move towards removal of these flex schedules and getting all kids back in the building, and that's where we're going, is really important. So the sooner we can provide actual, confirmation of that, obviously school system is in the state school board are going to have to speak on that. But I just think it's really important to send that signal that that's where we're heading to folks. So I appreciate you saying that. I guess my last question, many have been asked. I had asked a few weeks ago about some of the targeted, there was a really dark red area in that map, kind of up in the upper East County. And there's some other areas, and it's obviously, while we're making improvement, it's, some of them are stubbornly, persistently red. And I was happy to hear about the strike teams, looking forward to hear more about that. But can you get to us two questions, just kind of what those communities are and what exactly is happening and what are the strategies that you're using in some of those places where it's just been stubbornly persistent. And because I think we all could have ideas or community partners that we send anyway, but I just really want to get down to the community level of understanding where those are and what's going on across the county. So you can speak to it now, but I think as a follow-up, I would really like to know, what's going on in those areas.
Sure. So I think the longer answer is yes, we will follow up with you and provide that data. The short-term answer is we've been looking at that for some time, based upon the conversation that we had. And so one of the things that we've tried to do is to help to use that to inform, when we have had opportunities. For example, when FEMA has said we've got resources, or the state mobile team has had resources, we've been trying to position some of those clinic opportunities in those areas or adjacent to those areas to provide further opportunities. That's been the short-term solution to help drive up the numbers. And you're right, the larger conversation is doing a deeper dive for any other community factors. And within that, we'll have the team do that, complete that deeper dive and provide you with the data, and we can engage in that further conversation.
Great. Thank you. Thanks for everything that you all are doing. All right. And just to the public, I'll say we traveled to New York to see surprise my wife's mother for the first time we had traveled anywhere. Everyone was vaccinated. We hugged people for the first time in a year. There's really benefits to getting vaccinated. So just would encourage everyone to continue to do that. So thank you.
Indeed. Okay, Councilmember Glass.
Thank you very much, Mr. President. Thank you, doctors, for another very encouraging update. Last week, you told us that 54% of residents had received one dose. This week, you're telling us that 56% have received a first dose. And now we know that there are about 35 to 45,000 more residents ages 12 to 15 who are going to be eligible for these doses. So we're quickly going to be reaching the 60% threshold so that we can lift more restrictions and get back to normal. So this is all good stuff. And as you have all said, and my colleagues have all said, if we want to get back to normalcy, we need each of our residents to get vaccinated. We need them to get their family members vaccinated, their coworkers, their neighbors, because that is the key to having an open and safe community. And so I'm going to stop there and just thank you all. And I know that we will have more conversations about the 12 to 15-year-olds. And I'm sure parents are already starting to hit refresh on the various websites. So I'll stay tuned for those updates from you all as we prepare for them and prepare to get everybody healthy, safe, and reopened. So thank you all for everything that you've been doing.
Thanks. Councilmember Reamer.
Thank you. I appreciated the questions Councilmember Jawando was asking about the fall, and I just wanted to kind of follow into that. I totally understand Dr. Gales's response because there are various issues that he's working through. I think it's really important for us to be clear about our expectation, which is that school will be full capacity in the fall. I just can't foresee any reason that school would be partial capacity. And I don't think there is a chance that it will be partial capacity. I firmly and clearly, truly believe it will be 100%, with the exception of those few students who want to do a virtual academy. The recent work to design the virtual academy may be creating the impression that they're seeking to have a fallback that would, apply to a large number of students. But we've got to send out a message to the families like this fall it's going to be, and I know we don't control this because we're not the Board of Education, but we do have a platform, that we expect that it'll be full capacity. I mean, my sons, of course, are in school, and it's shocking to me, my middle schooler is sitting in classes with 3 or 4 children. That's as many kids as he has in the classroom now. And, we've got to get past this one group of students one week, another group another week. There's very little incentive for families, frankly, to return their kids to school in this environment anyway. So I don't know how we can do it, but I just think sending out a clear message to the community this fall, full-time, all students, that's what we're going to do. A lot of school districts, of course, have been in all the way. So there should be plenty of science to rely upon by then. Thank you very much.
Thank you. Councilmember Rice.
Yeah, Dr. Gales, I just wanted to follow up on one of the things regarding the vaccination, because there's been a lot of misinformation out there about the type of vaccination that our young people would get, ages 12 to 15, and whether it's the same, tube frequency. Could you talk about what the dose is? Is it the same as what adults receive? Scheduling time frame, is it still the same as what adults? Can you just lay all of that out for us?
Sure. And thank you for the reminder. I think we just assume that people know what we're saying. Well, you're going to get Pfizer, you're going to get this, is that people are familiar with that. So thank you for the reminder to explain that. So to take a step back, as you know, there have been 3 vaccines that we have used here in the U.S. That has been the Pfizer dose, which is a 2-dose regimen, Moderna, a 2-dose regimen, and the Johnson & Janssen dose, which is a 1-dose regimen. All of those have been approved by the FDA and CDC for individuals 18 and up. Throughout the pandemic, though, the Pfizer vaccine, due to their clinical trial, was approved for 16 and up, just the Pfizer one, the 2-dose regimen. And for 16 to 18-year-olds, they received the same dose as adults under the same schedule. Now, to date, all of them have been, I think, to some degree, doing clinical trials on younger people to be able to be used. Pfizer is the only one who has submitted their application, which was preliminarily approved by the FDA on yesterday, and will get an official hearing by ACIP, the Committee on Immunization Practices, on tomorrow for full final approval. Once that happens, the Pfizer 2-dose regimen will be open and eligible for those 12 to 15. And so the parameters in terms of the dose, as well as the frequency and the need for 2 doses, will be the same for that 12 to 15-year-old group as are the older groups. So when your child, if you're a parent watching at home, or if you are a child, and again, as a pediatrician, everyone under 24 is a child to us, so don't be offended if I'm calling you as a teenager a child. But the child also, if you've got questions about it, you will need to get 2 doses, and the time frame within them will still be approximately 3 weeks.
Thank you very much, Dr. Gales. I think that's just important for the parents that are certainly watching at home. And just to follow up on a point that Councilmember Reamer made, MCPS was very clear that they are returning to full school in the fall. They sent out that announcement to all parents via text message, their website. So they're very clear as to what is going on. Now, of course, we don't know what the future holds, but based on the trajectory and everything that we have, there's no reason to assume that it would be different from where we are right now. And so, we're very happy to see that. We know the benefits that that's going to mean for our children, and really want to thank the Board of Education and the superintendent for putting out that message early so that parents know that they are intending on full school in the fall, in-person learning, with supports for those who still may need to remain home for various types of reasons. So, thank you.
Thank you. And apologies to Councilmember Navarro, who I skipped earlier.
Yeah, like 45 minutes ago, but.
Oh, I'll make it up.
Hey, well, a lot of my questions have been answered already. And so much appreciate the team. This is both extraordinary, and at the same time, as we're now trying to figure out those very important next steps, I think it's going to require perhaps for us to have some other conversations. The question that I had really to do with how specific are we in terms of the analysis of where those 250,000 folks might be. Are there any patterns, as it had been asked before? Do we know how, where specifically, any particular communities? I mean, as we have been so proactive in addressing our Black and Brown communities, do we see that perhaps we're going to have to do a little bit more in those areas? And I'm really interested, as we're of course going through budget, and then when the Arpa funds begin to come through, do we need to strengthen some of those areas? So, if you have any thoughts right now that you can share, that'd be great. I know that you mentioned to Councilmember Geronda that you wanted that you would kind of circle back with us, but I'm just very curious because I think we have such great templates that we could just, target more, enhance more, and then get those numbers up so we can begin to open up much faster. Any thoughts in terms of just general patterns that you're seeing?
Thank you, Councilmember Navarro, for that question. And certainly that'll be a part of that analysis that, I spoke with Councilmember Geronda about. I think one of the things that we are missing, because as you mentioned, we've got a pretty robust infrastructure to address a lot of those other social determinants and barriers. And, thank you to you all, thank you to the county exec's office, thank you to our community partners for collective engagement around that to build that system and to continue to build that system to do that. I think in some places, one of the areas where we haven't really factored in as much is where there are ideological differences around vaccine hesitancy. In terms of, I do think we have some pockets of folks within our county who, for whatever reason, ideologically or politically, who aren't interested in the vaccine. And so that's the one piece, not to say that's the only reason why we've got that, but I think the piece where that is a little bit more underdeveloped in understanding what the real impact of that is. And I think we've got to think through a little bit, how do we address that and how do we move forward? And I think there's varying degrees of that hesitancy. I think there is on one end of the spectrum, kind of we're going to continue to wait and see how it goes, as I think Councilmember Reamer referenced, or maybe it was Councilmember Albernos, where there was 30% of parents who said, I'm going to wait and see how it goes before I do it. So I think we do have some of that where people are interested in it, but they're still a little skeptical and waiting for further results. And on the other end of the spectrum, I think there's some folks who are just, maybe anti-vaccine, and just not interested in the vaccine for whatever reason. That's less about the science and more about, ideology. So I say all that to say that I think we've got to include that as we do the analysis, where I think we've focused a lot of our energy, rightfully, in terms of removing those barriers for those who are interested in getting vaccinated to make sure they have those opportunities. And to continue that, but also have a better understanding of this other phenomena so that we can think through, as you mentioned, how to leverage those resources we have in place already to address that, and what new tools we need to pull out to be able to reach the concerns of that population.
Thank you. And I'm sure, of course, that the hubs can provide some really good feedback to us. So I would be really curious about that. Dr. Stoddard, I'm sorry, you were going to say something?
Yeah, we are looking at, so we do have information about who's been vaccinated by zip code, and we are looking at, so basically, not just, we have data about not just population total, but, percentage of population that is minority, for example, and what is the relationship between the vaccination rate and the population, minority population that's been vaccinated or not. And so we can start to see some of those breakdowns. And candidly, there are places where we've totally or nearly eliminated the minority gap, but still the percentage is too low, meaning that there's some other dynamics going on there. And so I think every zip code has a little bit of its own story about, this zip code is coming out at high levels, but there's a larger than average gap in our Black and brown populations. But this, in other places where fewer people are coming in, but there's no gap. And so there's some interesting characteristics that each zip code, and then everything in between. So we've got areas where we've actually got a greater portion of the population in the Black and brown community is vaccinated than is reflected in the community, and it's sort of each zip code or each area of the county has its own separate story, and so we are absolutely looking at those, and that helped us with the targeting of our text messaging campaign, with the targeting of our outreach campaigns, and so we could go almost zip code by zip code and tell a little bit of a interesting different story about where everything's at. But certainly we'll take a look more at those places that appear right on the map where the rate is substantially below the average county rate. And that's actually where much of the efforts are focused.
I appreciate that. I think that it sounds like a really awesome strategy, and can give us really rich information about, tailoring and targeting. And of course, another thing that hopefully will help us is that our very own Chef Jose Andres has offered an extraordinary incentive for people that go to his restaurants or are fully vaccinated. And I know it's been talked about nationally. Continue to be so grateful to his innovative tactics and his extraordinary contributions, not only to our county, but really the region and the country. So, if maybe you need a little push, maybe that's another really great incentive, because of course his restaurants are awesome. So a little plug there for Chef Jose Andres, who is furthering public health and vaccinations throughout the region and the country as well.
I may actually have to go back and rethink my vaccine status just to qualify for that. So, true. Thank you.
Well, I was thinking about that as well. And the last thing I will say is that my household is now finally vaccinated, fully vaccinated. And it was wonderful to celebrate Mother's Day in such a way. But, what Councilmember Reamer was alluding to, it is true. I personally have felt that, that my outings were very specific, to the grocery store, to just run a very important errand. And it was, my young adult daughters literally had to say, Mom, we need to take you out for Mother's Day because, you're fully vaccinated, Mom, it's okay. But it's true. You get into this sort of psychological space where you're trying to be so extremely careful. And I think especially for our elderly, it's a big burden psychologically and emotionally. And I think, yes, to the extent that we could begin to send some signals out there about, how safe it is, and it's okay if you're fully vaccinated. And after those, 2-3 weeks, you can start venturing out and enjoying. And it was a wonderful Mother's Day, and I'm glad I ventured out of my comfort zone. So.
Excellent. Happy Mother's Day. Dr. Stoddard, that's an intriguing answer. If every zip code has its own little micro story, are there 2 or 3 examples you could give us?
Sure. I'm sort of looking at the data set here, and I apologize. So, for example, let's take so 20903 is a good example, and so that's Hillendale listed here.
I know.
Only about 31% of the population there has been vaccinated, and there's still a large gap between between the percentage of minority population and the percentage of minorities that have been vaccinated in that region. So that's an area where we've got to do our traditional equity-focused efforts. But you contrast that with, for example, other parts of the county where Dickerson, for example, is at 53% overall vaccinated, but the rate of minority vaccination or Black or brown residents is 25% above the percentage that would be reflected by the population. And so going just down the list, there's stories like that across the board where there's areas where there are higher vaccination rates. And I'll give you, so Bethesda, for example, 20814, we're at 65% of the population that's received at least one dose, and we're 5% above the percentage that you would expect according to minority population. And that there's similar stories like that across the board. The same story is in Durwood, 20855. We're 70% first doses and 7% above the what you would expect based on population for the minority population. And so it's sort of a little bit all over the map in terms of where you see places where we're higher than the average of the county, and also higher in population reflected minority vaccination rates. So it's sort of there's interesting stories to observe here in the data. And the team is using those to sort of target where we spend more of our time and effort and energy trying to target different populations based on what the data is telling us is happening in those zip codes.
And so Council President Hooker and Councilmember Navarro, just to add to what Dr. Stoddard and Gale shared, we have been in conversations, and as Dr. Gales indicated, as part of that hesitancy strategy in collaboration with the University of Maryland and looking at the data, and we know that the top 3 data points identify those individuals who may have health literacy challenges and who may be uninsured. So one of the strategies that we targeted and focused on was having our FEMA strike teams to go back into those highly prioritized zip codes so that we know that individuals who are in those comfortable in those spaces are more likely to return for their second dose, as opposed to having them go to another site that may be outside of their comfort space. And so all of these targeting strategies within the zip codes are part of that strategy to increase our vaccination rates and to get more folks vaccinated and more shots in arms. I just wanted to share that picture as we look at the triangulation of all the data points to get more folks vaccinated.
Okay. That's very helpful and interesting. Dr. Stoddard, I'll give you a call about Hillendale. I have a number of suggestions there. Okay. Any other questions from colleagues or comments? All right. Thank you all again for all your tremendous work. We're making a lot of progress, and we're really grateful.